the word gum disease is divided, in my mind, into two parts. You have what we call periodontal disease, which means that the bone is affected by the bacteria. And you have what you'll hear the word gingivitis. Gingivitis is a much milder condition, but it's a precursor as we're moving our way along the continuum to getting to periodontal disease. The way they're treated, gingivitis is you need to have your teeth clean, you need to get the bacteria and the calculus that builds up on the top of your teeth off of there. Periodontal disease is treated by a more invasive procedure to take the bacteria off of the root surfaces. The hygienists have specially designed instruments that fit into those concavities on your root surfaces. You have to remember, your roots are not perfectly shaped cones. They have dips in them. So when you floss your teeth, you hit the high spots, but you don't get into those concavities. So a professional cleaning is needed to take care of the gum disease.